Hi, this is Dr. Falk, and I'm here today to talk to you about hair loss, hair restoration, and hair transplant. So, where do we start when we talk about hair loss? The first step really is to try and arrest the progression. Now, there are several means of doing that, and we strongly advocate that all patients who are interested in retaining their hair start with medical therapy. Medical therapy really consists of two lines of attack. The first is what we can do topically to retain hair. And the only FDA-approved topical treatment for hair restoration or hair maintenance is minoxidil. Minoxidil, it's available over the counter as Rogaine, and also there are some generic equivalents of that. This product, when used appropriately, can help maintain hair that you already have. It may subtly take hairs that are beginning to show signs of thinning and refortify them. Minoxidil works in a way that we don't fully understand. We believe it has something to do with increasing the vascularity to the scalp, although by no means do we really have a full explanation. There are other products out there like minoxidil, and the one that we tend to endorse is Formula 82. Formula 82 is a compounded mixture of minoxidil plus tretinoin and a mild steroid as well as vitamin E. This product seems to have a little better efficacy, and when trying to do our most, this may be something for people to consider. So outside of the topicals, the other approach is oral medication. The oral medications out there for treating hair loss are finasteride. Finasteride is a 5-alpha reductase inhibitor. That means that it actually stops the terminal formation of testosterone-based hormones that seem to be the trigger for male pattern baldness. Finasteride exists as the proprietary name Propecia, which is a 1 milligram tablet. It also is available in higher strengths when it's used to treat other medical conditions such as prostate hypertrophy. But it does seem to really make a difference in certain individuals. Now, transitioning from medical therapy, I should introduce the idea of light-based therapy. In this category are low-level laser therapies that seem to, again, have a very stimulating effect on the scalp. They've been out for quite some time. Initially, they were introduced as office-based treatments. Realistically, however, these office-based treatments are not a practical solution for individuals because it requires almost a lifetime dedication to return to the office. So, the makers of these devices have become much more savvy and have made home-based friendly models of these options. One that we seem to be having some success with is something called the iGrow. And this is an example of the iGrow helmet. This is worn by patients when they initially start the therapy about 3 times a week. Inside are a series of arrays. These arrays are emitting low-level laser as well as low-level light-based therapy in a pattern sequence theoretically optimized for scalp stimulation. The results are mild to moderate at best. I have not been too successful with this technique, but I do encourage individuals who are seeking to maximize hair retention to consider this. I think, again, the earlier you start with these devices, the better off you are. So, after discussing medical therapy, light-based treatments. Really the next step in the hierarchy is to think about surgical-based hair restoration, i.e. hair transplantation. Hair transplant is the only permanent way to restore hair to the balding areas of the scalp. Hair transplantation has come a long way over the past 30 years. Hair transplants of today are not your grandfather's hair transplant plugs. A major difference has been with the understanding that we dissect our hairs to very small units. These units are the natural way that hair grows, and as such they are planted in a way that naturally restores the look of a normal hairline. Today's hair transplants are really indetectable, even to a hairstylist. The concept behind hair transplantation is really quite simple. We take hair from parts of the scalp that permanently are retained, and those areas are called the fringe, i.e. the perimeter of the scalp. These areas seem to be retained in almost all individuals, despite even aggressive hair loss. These hairs are harvested and then transplanted to other areas of the scalp, which are more predetermined to lose hair. When these hairs are transplanted, they retain the characteristics of where they originally came from. So hair that was around the fringe, which is not subjected to male pattern, planted to the scalp, are retained indefinitely. Let's talk a little bit about competing techniques. And the two techniques that you're going to hear a lot about are follicular unit extraction using automated punches and the tried and true strip method. Is one better than the other? Well, that's sort of a matter of opinion, but on the other hand, they can be equally effective and good treatments for the right patient. First, let's talk about follicular units, those small clusters of hairs, maybe one hair, maybe 3 hairs, maybe 2 hairs, using a small punch. Most of these punches for efficiency are accomplished with motorized drills. Now, there are a variety of motorized drills out there. The one that seems to have the immediate attention is NeoGraft. NeoGraft uses a motorized punch that has a little bit of a suction apparatus attached to it that extracts the hair plug with the drilling process. Is this the best way to do FUE? I don't think so. It is certainly a way to do it. We tend to use another motorized device that accomplishes the role of scoring each plug, but then we manually extract the plug to take it out. There are benefits to this as well. I think we get less trauma to the plug when we do it this way. We can preserve more plugs, and this is because when we do it, we are actually watching as we tease out the plug, so we're not transecting the hair as it comes out. Now, FUE sounds great because there's no linear scar. Instead of cutting a strip out from the back of the head, we are actually drilling multiple little holes. One of the disadvantages to this approach is that you really are harvesting from a much broader area of the scalp. So, if you want to get 2,000 grafts, for example, using FUE approach, you're going to have to harvest from a big, broad area of the scalp. To do that, you have to shave the scalp down fairly close to the skin margins. And you have to be careful about how you harvest these in a randomized fashion so that you are not taking too much hair from one area to cause a spotty-like appearance. It's as if you could overgraze your scalp. and that too has some ramifications. However, in the right patient, it does heal quite well. I do recommend FUE for younger patients, for example, who may wear their hair cropped very tightly. If this is how you like to wear your hair, then FUE definitely has some benefits. I'm going to show you a little bit about what it looks like. So this is an illustration of a patient that we've taken care of, and if you look carefully, you'll see that we've harvested many small 1 millimeter punches. Looks a little bit frightening, but the reality is that with wound contracture, this heals up very quickly and really becomes almost indetectable. For example, just 1 day after treatment, this individual's donor site is looking already quite respectable and beginning to be at a point where he is comfortable going about his business. So those hairs are harvested from the back of the scalp and then transferred into the scalp. And again, 1 day after the procedure, very acceptable. He can go about his business. Has to be a little bit mindful of maybe some micro spot bleeding. But again, that's one of the advantages of the FUE approach. About strip technique. Well, strip grafting is really the workhorse approach to hair transplant in the majority of the centers around the country and the world. What's nice about the strip technique is really the efficiency. We can harvest a lot of hair in one session using this technique. The hair, again, is harvested from the fringe area behind the scalp, and the incision is camouflaged by only shaving a portion of the scalp where we are going to harvest the graft, which when closed really completely conceals the donor site. Who is a candidate for strip grafting? Well, I think that individuals who are at their matured stage of hair loss and who know from years of life experience the way they wear their hair. In other words, if you know that your style is to wear your hair relatively 1.5 inches long to 1 inch in length, then this technique doesn't really present as a major concern in terms of the scar. Now, there are things that we do to help conceal the scar as well. This is called a trichophytic closure, and all that means is that we bevel one edge of our incision and overlap the two edges on closure such that hair actually grows through the scar on healing. The issues with strip technique have to do with perhaps over-aggressive harvesting, and that's where experience and frank discussions with your surgeon are so important. If you are completely bald and you are trying to get a full head of hair, you're going to need more from the donor site. So planning a hairline is very important, and that has to be done with realistic expectations. In conclusion, I think that there are excellent opportunities to help individuals who are struggling with issues around hair loss. These approaches combine the best medical therapy, laser-based treatments, and finally surgical approaches. There is no single surgical approach that's right for all individuals. It needs to be tailored to the patient's hair loss pattern and preferences. For that reason, we offer both FUE, follicular unit harvesting, as well as strip techniques. If you'd like to learn more about our approach or would like to come in for a consultation, please do not hesitate to contact us. Have a great day. Take care. I'm Dr. Falk.